Alrighty. Onions number 1. Number 2, the gang. Can't see my feet. Benjamin Franklin said, "An ounce of prevention is worth a pound of cure." Regular blood testing is that ounce of prevention, offering a healthy way to catch health issues before they become serious. The purpose of this speech is to convince people that regular blood testing is a necessary practice that empowers us to detect health issues early, manage existing conditions, and make informed choices to improve our health. I'm credible to tell you about this because not only have I benefited from getting my blood tested and making my routine adjusted accordingly, but I've done extensive research on the how, when, where, and why of blood testing. I've seen people around me suffer from fatigue, confusion, lightheadedness, and other physiological ailments that they think is just normal. They change their diets and routines to figure out what the problem actually is, when in reality, getting tested to see what vitamins you need is a more direct way to figure out what the problem is way faster. In this speech, I'll tell you what kind of ailments are frequently disregarded, what can happen if you ignore those symptoms, how to discover what is causing them, what you could discover, and where to find out information about testing, where to get tested, and how to make an appointment. First, why should you? According to the CDC, one person dies every 33 seconds from heart disease, which is the leading cause of death worldwide. There are a lot of risk factors whenever it comes to heart disease, including your age, diet, cholesterol levels, and physical activity, and much more. Despite being very easy to fall into heart disease, there are many methods for prevention. When detected early, a change in routine, lifestyle, and environment can be extremely beneficial. To detect whether or not you have heart disease or are at risk, you got to get your blood tested. Anemia is a blood disease that affects 3 million people in the US alone. The National Heart, Blood, and Lung Institute defines an anemic person as having a lower than normal healthy red blood cell count, which is a blood cell that doesn't have enough oxygen. It can cause you to feel dizzy, fatigued, out of breath, and many more symptoms. It's caused by age, lifestyle, blood loss, and a bunch of other factors. To find out if you have anemia, you got to get your blood tested. Consistent checkups with your physician, as well as an annual blood test, is the simplest and most effective way to stay in charge of your health. Changes to your routine environment can change how healthy you are in an instant. According to Johns Hopkins Medicine, blood testing can help you to find out how well your organs are functioning, how well your current medications are working, identify bleeding disorders, check on your immune health, and to diagnose diseases like diabetes, heart disease, anemia, HIV/AIDS, and even cancer. Early identification of diseases is important because it reduces the number of complications that you encounter during prevention and treatment. It can save you money and surgeries and emergency treatment measures, prevent further medications and screening, and many more benefits. Treatment of blood diseases like anemia can be done through supplements or blood transfusions, and is a very safe way and has improved the life of many people. And again, the quicker it's identified, the quicker you can make the changes needed to combat it. These kinds of illnesses change the way that you live drastically, and you may never know that the fatigue and discomfort that you carry is actually something that can be prevented. It's very accessible through informational sites like testing.com. You can find out exactly what test you need and how to get one, and there are even at-home tests to administer if you don't want to go to a lab. Vitamin deficiencies are also common problems that can be easily identified using nutrition-specific blood tests. Adjusting your vitamin intake and diet according to what you have a deficiency or surplus in can help you solve problems like brittle nails, hair loss, and restless leg syndrome. What you should do first to get your blood tested is to make an appointment with your primary care physician, lay out your concerns with your own health, or just that you would like a blood test for your own information. Or you can make an appointment with the nearest blood testing lab to you by going to testing.com, scrolling all the way to the bottom to the directory, and finding a lab that's closest to you and making an appointment. These are free or low-cost community centers that span all the way across Colorado, so they're accessible to everybody. That same website is a great informational site that can tell you about symptoms, diseases, information about how they test and where it's tested, and much more. If you don't feel like making an appointment immediately, you can do research about symptoms, about you or your family members, risk factors that you can use to prevent even needing to go, and anything else that you want to do. But do it through testing.com, testing.com. There are a few different tests that you can do for different panels and information depending on what you want to know. There's a basic metabolic panel, which screens your overall health, kidney function, blood glucose, calcium, and electrolyte levels. This is the most common and will help you assess your overall health and screen for basic problems, whether or not you need further screening, and a bunch of other information. There's also a blood clotting test for blood clotting and bleeding disorders, a complete blood count for anemia as well as bleeding disorders, a lipid panel for cholesterol levels and heart disease, and an STD panel for STDs like herpes, chlamydia, gonorrhea, and much more. To conclude, I told you some diseases that can be prevented or dealt with early, how you can remedy them with blood test and routine adjustment, what will happen if you do, and how to get tested. It's important for your health to satisfy those physiological needs so that you can focus on other parts of your life without having this burden. Schedule your next blood test today, take charge of your health, and empower yourself to live a longer, healthier life.